You're live.
We're on live now. Okay. Hello, wherever you are. My name is Robbie Mahood, and I'm a member of Socialist Action, Ligue pour l'Action Socialiste from Montreal. I have worked as a family physician in a community-based clinic for the past 25 years in Montreal, and prior to that in Winnipeg. I'm originally from Saskatchewan. Welcome to this second in a series of Socialist Action live stream webcasts. Last week, the subject was the United Front. Next week, the topic is the Leninist conception of the party. Future topics will include eco-socialism, the fight against fascism, issues in queer liberation, and an introduction to Marxist economic theory. Today, we will address the coronavirus pandemic from a socialist perspective. We will hear from initially from Daniel Tarade, a PhD student in science at the University of Toronto and a member of Socialist Action. And I will follow up Daniel's remarks with some of my own, focusing on the broad social and political ramifications of the crisis. After that, we are delighted to have contributions from Basia Sokal, a postal worker and union activist in Winnipeg, and Janna Pratt, a uniform member in Saskatchewan. We welcome written questions from folks who are watching, and I invite everyone to visit the Socialist Action website at www.socialistaction.ca. Now, let me just preface this webinar with a few introductory remarks. I imagine that most of us are either like me in some sort of self-isolation mode, or at least observing social distancing, so-called. The coronavirus is spreading across Canada and most countries in the world. From where I sit, the epidemic is in its early stages. What are the reasons for the emergence of this threat to our health? How far will the virus spread, and with what lethality? Why is our healthcare system so ill-prepared to cope with the COVID-19 outbreak? What lies ahead both domestically and on an international level? These are some of the questions we hope to address today. Our perspective will be unapologetically socialist and will integrate as fully as possible a scientific understanding of the pandemic. So I will close my introductory remarks there and pass the floor to Daniel Tarade, who will be our first presenter. Daniel.
Seems Daniel is having connectivity issues, so you may want to continue on with your own.
With my presentation? Okay. I'll try to jump in at a certain point in my presentation. Perhaps I'll start by asking the question that many of us are interested in: how lethal is this virus? The data from China and South Korea would indicate a rather low case mortality ratio. This is the way we measure the lethality of an epidemic. In those two countries, it's well below 3% and possibly even 1%. On the other hand, we have countries like Italy that has a case mortality rate which appears to be as high as 8%, and Iran's mortality may be even higher, as high as 12 to 13%. At the present time, the case fatality ratio for Canada and Quebec is at the low end of this range, probably around 1% or even less. But even if the case mortality is low, if the virus penetrates widely in the population, deaths will rise rapidly and quickly overwhelm the capacity of fragile health systems to to deal with a large number of ill and very ill persons. If these fragile health systems are overcome, this will be even more the case in the global south, where healthcare resources have been degraded by many years of austerity, which is also true in the case of richer countries like Canada. For example, if 4 billion people contract the virus, even at a very low mortality rate, this would result in 40 million deaths worldwide. So you can imagine how devastating this epidemic could potentially be. Well, I'm going to try to leave some space for Daniel to address some of the scientific questions and epidemiologic questions, and I'll pass along to address more the social and political ramifications. We've been told in the particular case of COVID-19 that the elderly and those whose immune systems have been otherwise weakened are most at risk, and that is true. Mortality starts to increase after age 60 and rises steeply after age 80. What is not mentioned by governments and rarely in the media is the differential effects according to income and wealth. Everywhere, poverty and marginalization will increase vulnerability. Now, all capitalist societies are divided along class lines. Access to care and the effects of quarantine are experienced very differently if you are rich or poor. This applies even to Canada. Those countries that have maintained their public healthcare systems, despite damage by neoliberal policies, will fare better than countries that suffered near complete dismantling of public healthcare, or like the United States, that lacked universal coverage in the first place. So the impact of the epidemic will differ among countries. Global capitalism in the 21st century is in reality an imperialist system, wherein a small number of rich countries dominate and exploit to varying degrees a much larger number of weak and dependent states. Neoliberal austerity measures have degraded public healthcare systems almost everywhere, but especially in the countries of the global south, as I mentioned, which were forced to submit to the most draconian cuts demanded by institutions like the IMF, the International Monetary Fund, and the World Bank. It's still an open question to what degree the coronavirus will penetrate the countries of the global south. But if it does, we could expect deaths to skyrocket, particularly if it starts to spread in those great slum-laden cities like Lagos in Nigeria, Kinshasa in the Congo, Karachi in Pakistan, Dhaka, Bangladesh, or Jakarta in Indonesia. But let us not forget those countries which have been targeted by imperialism and subject to punishing sanctions or embargo, notably Venezuela, Iran, and Cuba. Iran is one of the countries that's been particularly hard hit by the virus. Yet, under harsh sanctions, it has been denied access to medical assistance. Despite the embargo, Cuba is playing once again an exemplary role. Cuba was the only Caribbean country that would accept a stricken cruise ship and deliver care to infected passengers recently. It has offered to send doctors and nurses to Italy, which has been hard struck by the epidemic. And ironically, faced with the coronavirus threat, Brazil reversed course and requested the return of Cuban doctors by its extreme right-wing president, Jair Bolsonaro, who had earlier labeled and expelled these doctors as terrorist subversives. After an initial stumble, at first denying the threat and even reprimanding the physician in Wuhan, who first alerted the world to the novel coronavirus outbreak, China has recovered adroitly and enhanced its international reputation by vigorous intervention that appears to have contained the domestic spread of the virus, at least for now, and by also assisting countries such as Italy with needed medical equipment, for example, ventilators. The Trudeau government in Canada has been one of the most vigorous enforcers of sanctions against Venezuela and Iran, and it steadfastly refuses to pressure Israel to lift its siege of Gaza, where the first cases of COVID-19 infection have appeared recently. The lesson we should draw from that is not that Trudeau is a deluded minion of Donald Trump, but rather that Canada is a modest but important member of the imperialist alliance, which sees correctly that such an alliance is important to advancing the global interests of Canadian capital. Canada and Quebec, like much of the developed world at least, is on lockdown, with widespread social distancing, if not self-isolation, closure of schools, restaurants, and other public venues, and the shutdown of key industries, or at least the pending shutdown of key industries. Recently, an example would be construction prompted in Ontario, and Quebec prompted by the refusal of workers to accept unsafe working conditions. Canada is among the countries, unlike South Korea, Singapore, and Australia, that did not embark on widespread testing and selective isolation of cases and contexts at a point when this might have made a difference. As a result, we are at the mercy of the contagion, waiting to see if the quarantine approach will be effective. This is an uncomfortable position, but there is very little choice at this point. Nor has Canada considered treating symptomatic cases with antiviral drugs. And it must be admitted these drugs have not been rigorously tested for COVID-19. Possible agents here would include hydroxychloroquine or even interferon alpha-2b, which was developed by the Cubans. These drugs would definitely not cure, but might attenuate the disease. Now, the Globe and Mail published a revealing investigation in its March 21st issue by journalists Mike Hager and Andrea Wu into conditions at North Vancouver's Lynn Valley Care Centre, a private nursing home, where Canada's first death from COVID-19 occurred on March 8th. 7 more deaths in the same institution were to follow. The story recounts the devastating impact on workers, victims, and their families, but it also draws links to the deterioration of healthcare under capitalism's decades-long neoliberal regime of cutbacks and privatization. Workers at Lynn Valley were once unionized, but management broke the union in favor of private subcontracting that cut pay by $2 an hour, slashed sick time from 10 to 3 days per year, and holiday time from 22 days to 10. Said one worker, "We don't have enough sick time. Even if people are sick, we are still working, and that's the truth." That is indeed how the outbreak at Lynn Valley started. The Lynn Valley tragedy speaks volumes about capitalism's inherent drive to place profit before human welfare. In the meantime, the stock market is in the throes of a major upheaval with the threat of a different type of contagion, that of debt defaults, bankruptcies, and ultimately the liquidation of a massive amount of capital, which has long been overdue. Coronavirus is not the cause of this economic crisis, but rather the spark of this impending economic meltdown. This portends a major recession, if not depression, whose depth and duration are still unknown. To the immediate threats to health and economic survival must be added the consequences of climate change, the early signs of which are already apparent, but which will be magnified in the medium to long term. Well, some have argued that capitalism is the source of widespread social problems that are many times more lethal than COVID-19 is ever likely to be. For example, the toll from narcotic or alcohol dependence, or the mortality from wars. And in addition, these critics point to the fact that we're being persuaded to sacrifice our freedom to protest and organize by the restrictions imposed by capitalist governments. I take a little bit of issue with this point of view. It doesn't seem to me to be useful to make history fit all of the elements of a pre-written script. I do concede, however, that the coronavirus outbreak has been seized upon by some regimes facing popular insurgencies in order to increase repression. We could note that this is the case in Chile, Algeria, and in Kashmir, the province of India that has been put under strict lockdown. These governments are attempting to suppress the insurgency and regain the initiative. Whether this will work remains to be seen. Dissatisfaction and unrest are certainly present in the richer countries as well, but even there, they are far from reaching semi-insurrectionary proportions. However, we should remain vigilant against attempts to increase state surveillance and coercive measures on the pretense that these will control the outbreak. I concur with others that solidarity and compassion are our strongest suits in this crisis. The disasters visited upon the species and the planet by capitalism in its latest imperialist stage argue for its replacement by a world socialist order in which democratic planning can heal the rift between humanity and nature while banishing exploitation, domination, and war. This gigantic transformation will meet with resistance by the exploiters. It requires the mobilization and conscious intervention of working people, both in Canada and worldwide. And it also requires the construction of a revolutionary socialist party. In the present crisis and beyond, what demands should socialists raise? Well, I don't intend to be comprehensive, but I would suggest the following. Full pay for everyone who is sick, required to care for children, or obliged to self-isolate and cannot work from home. Avoid pressuring anyone to work for economic reasons, requiring them to place their own or others' health at risk. Viewed from this perspective, the emergency income support promised and currently being rolled out by the Trudeau government, which amounts to apparently $2,000 a month for 4 months for all workers whose income has been cut by the epidemic. This, however, is not going to be nearly adequate. The Liberal government is committing less than 3% of GDP for COVID-19 relief, which is less than other countries. Oh, sorry. Sorry about that. An unspecified amount of this money that has been earmarked for COVID-19 relief will go to bail out the beleaguered oil industry. Laid off workers should receive full pay. Support the right of workers to refuse any non-essential work deemed unsafe. There should be a moratorium on evictions, rent, mortgage, and even credit card payments. We should remove the barriers to testing and assure adequate staffing to streamline access. We need to requisition unoccupied houses, condos, and buildings for occupancy by homeless or marginalized persons with adequate supports and provision for social distancing. The healthcare workforce should be enlarged and hospital beds as well to care for victims of the epidemic without diverting resources from other needed healthcare services. In the longer perspective, hopefully not too long, we need to argue for the nationalization of the pharmaceutical industry, to end the marketing of drugs and mandate rational prescribing. No bailout to the oil industry, nationalize the energy giants under workers and community control to begin the transition away from fossil fuels. And we should halt construction of all pipelines and fossil fuel infrastructure projects, such as the Trudeau government and many provincial governments are trying to advance. We need to nationalize the banks to fund social entitlements and invest in the eco-socialist transition. There should be a moratorium on student debt and ultimately free education from cradle to grave, eliminating all financial barriers to lifelong education. The unionized labor force needs to be enlarged to engage in the care of the elderly with adequate paid vacation and benefits. And we need to restore defined benefit pensions on the road to a universal public pension plan. Finally, on the international stage, Canada should withdraw from NATO and the Lima group. Ottawa needs to end its support for sanctions against Venezuela and Iran, among others. Canada should demand to break the siege of Gaza, support the right of return for Palestinians, and end support for apartheid Israel. So that's the conclusion of my remarks. And I hope that we've got Daniel on the line to continue the presentations and then to pass on to discussion.
I am here. Thank you so much, Robbie. So sorry for earlier technical difficulties. I would like to talk more specifically on what led to this outbreak, how that ties in with a broader pattern where we're continuously being faced with epidemics or pandemics that are brought forth by this capitalist system. So COVID-19, the first case occurs in Wuhan City in the Hubei province of China on December 8th. By December 31st, there's a report to the World Health Organization by Chinese authorities that they've identified a new pneumonia cluster of unknown cause. And at this point, there's only 27 cases reported. Very shortly after, they actually isolate the new coronavirus that is the cause of this pneumonia cluster. It is called the SARS coronavirus 2, SARS itself standing for severe acute respiratory syndrome. Coronavirus is the family of virus that this disease belongs to. COVID-19 then refers to the disease caused by this virus. Very shortly after January 7th and the isolation of the virus, they were able to determine the genetic sequence of the virus, which was shared widely around the world. And Robbie did correctly point out, initially, authorities in China cracked down on some doctors that were spreading information about this new disease and the outbreak. They detained a doctor and they forced them to sign a document saying that they were spreading rumors that was not true. This was obviously a misstep, and it definitely did allow for a bigger outbreak at the onset, but they recovered pretty well to isolate as many people as possible and to quarantine as many people as possible. And by sharing the genetic information around the world, that is definitely a model for science that we should see more of going forward. By January 30th, despite best efforts, after it became apparent that this was an important outbreak, the WHO declares a public health emergency of international concern. At this point, there are still fewer than 100 cases outside of China. And then by March 11th, we have a declaration of a pandemic. So currently, we have over 400,000 confirmed cases and 16,500 deaths. This is already far eclipsing what we saw with the initial SARS outbreak in 2003. So it's spreading exponentially in the USA, in Western Europe, and earlier outbreaks in South Korea and China seem largely contained. They reacted more proactively than other capitalist nations have. So I want to talk a little bit about what coronaviruses are. This refers to a family of viruses. So even though today you'll hear often on the news coronavirus, that is a more generic term. In fact, there are many varieties of coronavirus that have been known to exist since the 60s and cause the common cold. Yet there are 3 members of the coronavirus family that are known to cause pandemics. This includes SARS, which was the first member identified in 2003, where it killed fewer than 1,000 people around the world, but had a 10% fatality rate. And then you have MERS, or Middle Eastern Respiratory Syndrome. This was first identified in 2012. You still see cases every year, but it's not very infectious, but the fatality rate is 36%. And now we have the most recent one, SARS-CoV-2, or COVID-19, which I'll use more commonly. It is uncontained, We can only predict exactly how many people will be infected and how many people will die. The fatality rate is ranging from under 1% up to 3 to 5%. It depends on the country and where you're looking at. And based on those initial isolations conducted in China, where they identified that this is indeed a coronavirus, they did find that COVID-19 and the original SARS virus are the most related. At the protein levels, they're anywhere from 70 to 90% identical, depending on which proteins in the virus you're looking at. And it's from these initial studies that we can glean a lot about how this outbreak came to be. They isolated fluid samples from patients near the epicenter. The epicenter was in Wuhan, and it was a wet market where they sell various live and exotic animals. And from the isolates of COVID-19 from these patients, they found that the virus was most similar to a SARS coronavirus found circulating in bats, specifically horseshoe bats. And in fact, it's being widely reported now, but there was a paper that came out in 2007 where a group of scientists out of the University of Hong Kong described a large reservoir of SARS-like coronaviruses in bats, which, and this is a quote from their scientific paper, together with the culture of eating exotic animals in South China, it is a time bomb, end quote. So it was clear that this was a public health concern. But of course, like any sort of profit-based system, you have market interests there. These markets are largely unregulated. You can consider the cruelty to animal to be a form of exploitation. And because of how crowded and how close various animal species are together with the humans that are shopping there, it dramatically increases the risk for human disease. After the SARS outbreak in 2003, the eating of certain wild animals was made illegal in China to prevent other outbreaks, but this was rolled back. And this is what we see time and time again. Any sort of regulation, one, in a capitalist system is something that can be reversed very easily. Now, there is an appropriate socialist response to this. We should obviously call for the abolishment of all agricultural practices that are associated with severe ecological, ethical, and human health costs. The wet markets, as they currently are in various parts of Southeast Asia, obviously pose risks. But there's also a fairly widestream racist and xenophobic response to the wet markets that we should also condemn. For the people that call this the Wuhan virus or the China virus or the China flu, this is a racist and xenophobic attempt to try and mask the deep contradictions in our capitalist system, where the people in our means of creating food jeopardize the very people that eat the food. It's based on maximum yield and production, and that results in very dangerous systems for the consumers, where they're at a higher risk of being infected with different viruses of animal origin, or bacteria for that matter. And I want to make this point very clearly. It's not only from China or other Southeast Asian countries that we see pandemics emerging. In 2009, you have the swine flu, and this emerged most likely from pig farms in Mexico, although it's entirely impossible to pinpoint exactly if it was in Mexico or somewhere else because of the globalized nature of the animal and agricultural industries. And it's only something in our ultra exploitive agricultural system you can have influenza viruses circulating around the world without anybody monitoring this for potential outbreaks in the human population. And that's what we had in 2009. We had a major pandemic of swine flu that killed many thousands of people. Then you have the mad cow disease. This emerged in the UK. This emerged in 1986. And this is from cattle being fed very cheap food, meat and bone meal, which is of bovine origin. So they're feeding cows, ground up cows. And this led to a very dangerous disease that killed many people as well, although it's not as contagious or infectious in other cases. And then very famously, you have the Spanish flu that ravaged the world in 1918 and 1919. And this, by most recent hypotheses and what I believe to be most plausible, emerged in a pig farm in Kansas in the United States. So again, we have scenarios where animals are kept in very crowded, unhygienic scenarios. Their welfare is not being looked after, and neither is that of the consumer of these animal products. The bottom line is profit. You get more profit by growing as many animals as large as possible, paying as little attention to their conditions. You're just trying to meet that end goal. And this is something that threatens humanity time and time again. And the coronaviruses, whether it be SARS or MERS or now COVID-19, are just the most recent examples of the capitalist system threatening humanity in this way. And there's actually another very existential threat facing humanity that's more akin to climate change, in that it's something we've known about for a long time, yet we continue to ignore. And by we, I mean systems of profit. And this is that of antibiotic resistance. And this emerges all over the world from the industrial and inappropriate usage of antibiotics in animal feed and in inappropriate disposal of antibiotics, which is selecting for the most resistant of superbugs, which by 2050 is now being predicted to kill more people than cancer. So this is obviously another massive issue that's emerging, and this is independent of China or US or any other specific country. It's instead endemic, specific to a capitalist system where the safe usage of antibiotics is neglected, and instead we have usage of antibiotics based on promoting the growth of animals and profit. So this is something we need to condemn strongly, and a lot of the points that Robbie brought up regarding things we need to fight for and ways we need to restructure our society are very apt. In terms of the early spread of the virus, again, it was business as usual for most of the world, and this definitely led to a massive spread of the virus where it need not have happened. As Robbie mentioned, again, China definitely neglected the virus early on, but very quickly responded after coming to the realization, and they responded in a way that we haven't seen other countries respond. They built hospitals within weeks, aggressive quarantines, and now newly reported cases have dropped to nearly zero since early March. And the World Health Organization is quoted as saying this bought the world time, which has been squandered by corporations that instead cared about, again, maintaining business as usual and making profit. So you still have airlines around the world that are assuring the public that they thoroughly clean their planes and that it's safe to fly, despite the fact that all non-essential travel should cease immediately because we're spreading people around the world and we're leading to new outbreaks that can't be tracked and contained. We have the issue of cruise ships. There's now a cruise ship that will dock sometime next week in America that disembarked on March 7th. And the last I checked, there were over 40 people on board with flu-like symptoms. And it took this company, Holland America, until March 17th to suspend operations globally. So again, you could have still boarded a cruise ship, which is entirely non-essential, until fairly recently, despite the risk to yourself as a passenger and the risk of any place that ship docks as people with the virus spread around the world. You have stores around the world clamoring to be essential as governments are issuing fairly weak regulations. A very famous example in the United States was GameStop, which is a video game store that tried to say that they were essential until politicians specifically targeted them with shutdown notices. These are all things that are spreading the virus because you're allowing people to congregate in places, and that's what viruses need to spread. In Ontario, we have the slashing of sick days, whether paid or unpaid, under Doug Ford. It used to be 10 job-protected sick days, 2 of which were paid. Under Doug Ford, that is now just 3 unpaid but job-protected sick days, and which now require a doctor's notice. These are creating the conditions for people to choose to go to work rather than do the responsible thing and stay home. And these are all things that are leading to the massive outbreak. Just to finish on some more scientific points. Just like other industries, the scientific publishing industry is one of profit. And despite early attempts by scientists from China and elsewhere to share resources, including the genetic sequences and genetic information of COVID-19, many papers on the new virus, scientific articles, peer-reviewed scientific articles, the research itself having been publicly funded, were kept behind paywalls because that's how these scientific journals make money. It was in March 7th then that an online petition won a small victory in forcing a number of large publishers to open up these scientific papers. Over 32,000 scientific articles are now freely accessible on the topic of COVID-19 alone, which shows you how quickly scientists can respond to an issue and how for-profit corporate interests can impede this by hiding information behind paywalls. Now, in those early months before March 7th, this information was of dire importance. You have doctors who are withheld from information about symptoms, about severity, about how long someone is contagious. You have managers and other healthcare workers and politicians being withheld from information on effective measures, on sanitization protocols. These are all things that could have helped formulate a more appropriate and science-based response to the epidemic that was instead withheld for the purpose of profit. Now, it does raise the question, now that these scientific articles are made free to the public, as they should be because they're publicly funded research, it really asks or leads us to ask the question, why aren't all papers freely accessible to the public? This is something I'm going to discuss more. I'm going to hopefully publish a policy paper on this. But publicly funded science belongs to the public. In the long run, the crisis of COVID-19 is perhaps comparable to the crisis of cancer or heart disease or diabetes, and those papers still remain behind paywalls despite being of the utmost public importance. Lastly, I want to talk about how the pharmaceutical industry is responding to this, and they're responding in the way they normally do, which is intellectual property, patents, control, and profit. It was just announced recently that Gilead Science in the United States was granted orphan drug status for a potential COVID-19 drug, remdesivir. It's one of the drugs being looked at as a potential coronavirus treatment. And normally, orphan drug status is afforded to drugs for the treatment of diseases that affect fewer than 200,000 Americans. Yet Gilead rushed to put in this claim before COVID-19 affected that many Americans, which it surely will. Give it a few weeks and COVID-19 will affect not only 200,000 Americans, it will affect millions of Americans. Yet, having been granted orphan drug status, this pharmaceutical company now has a 10-year patent and exclusive control over this drug that, if it proves effective for treating COVID-19, will generate massive profit at the risk of preventing people from accessing this drug, or if they access this drug, being saddled with immense amounts of debt. That's not to mention President Trump's attempt to persuade a research corporation in Germany from moving their vaccine development project to America so that America would have exclusive control of the vaccine and any profits. Thankfully, this was refuted, but that does not make up for the fact that you have companies that have control over vaccines in the first place. And it doesn't matter if they're German or if they're American. Any private company should not have the control over a vaccine that is of human benefit, of human need. So I think at that point, I'll just wrap up with a few last points. Pharma and agro, as big businesses, do not mind crisis. They actually profit off of crisis, just like the industrial war machine. A crisis like this is great for the pharmaceutical industry because any vaccine, any medication they come up with, they will not even have to advertise. This is on everybody's mind. So for them, this is a great market opportunity. And that line of thinking is obviously perverse for most people, and it shows a contradiction in the capitalist system. As Robbie mentioned, and I will echo this point, the pharmaceutical industry needs to be nationalized. Scientists need to be coordinated around the world and not compete with each other, and instead work together towards the common goal of benefiting the human experience and human health. And that's something that we're going to fight for in Socialist Action and as a united front with other groups. I'll turn it back to you, Robbie.
Thank you, Daniel, for those very pertinent remarks about the science and epidemiology behind this pandemic. I'm going to ask for contributions, if we can have them, from our correspondents in Winnipeg and Saskatchewan and Regina, I think it is. But let's start with you, Basia. would you care to add some remarks from the standpoint of your experience out there in Winnipeg?
Yeah, sure. Great. Thanks, Robbie. So for those that don't know me, I'm a postal worker in Winnipeg. I deliver mail. I'm a letter carrier, and the last few weeks have been incredibly stressful. Given some of the information that we've heard, even just from Daniel, I don't think a lot of people in the general public are taking this as seriously as they need to be taking it. What's happening when we're out on the street and when we're seeing the public, they are acting like it's not a big deal when they see us. They're coming to their door because a lot of them are either in self-isolation or they've been laid off from work, or they're just taking extra precautions to be at home. So what's happening is we're coming to the door with a parcel or some mail, important mail. At this time, there was a lot of checks being sent out. It's income tax time. A lot of the customers are just greeting us at the door like it's not a big deal. They're just, oh, hi, it's great to see you. Thanks for my mail. And that's something that's really stressing out a lot of our members. And I'm pretty sure that that's going on across the country. But what's even more concerning is the fact that we just heard the list of all of the pandemics over the last, we'll say even just the last 15 years. There's been quite a few serious pandemics, especially those that include respiratory issues and illnesses. And it seems that the post office is just surprised by this. We always joke that, Christmas sneaks up on the post office. It's a big surprise. We seem to never be prepared. Well, the same can be said for this pandemic that we're dealing with right now. Is the post office is so unprepared, which is actually quite amazing if you think about the scope of how long we've been around, how many members we have working, and how many millions of dollars are spent each year on PR and prevention and health and safety that Canada Post claims to care so much about. I can't understand for the life of me how we can have fire drills, how we can have processes in place for things like substances or suspicious parcels, things like that, which are unfortunately quite common and more common at the post office. But we have no idea how to deal with a pandemic, and we are completely unprepared. Last Monday, when the pandemic was announced, there was pandemonium at the post office. We didn't have any cleaning supplies. We didn't have any Lysol wipes or whatever folks are using. There was no hand sanitizer. And big surprise, when management went out to try to acquire these supplies, there was absolutely nothing on store shelves, and there continues to be nothing on store shelves. So one of the big concerns for us is, as I mentioned previously, we are out in the public and we are communicating with the public. We are a first contact to the public. We touch so many things a day, and we don't even have a way to protect ourselves. So I see us as one of the big problems in this chain here, is because we could be potential carriers of the virus. And it is very easily spread, especially if somebody's coming to a door to greet you, especially if somebody is brushing up against you in an apartment lobby, or you're picking up parcels and you're coming in close contact with folks. I think it's very concerning that the public isn't taking it as serious as they need to, despite us having to work. Now, a lot of folks are concerned that we are working, a lot of members on the work floor. Personally, I think it is something that somebody needs to do, and if it is us at the post office, CUPW members, CPAA members across offices, RSMCs, folks in the plants, in the retail outlets, then so be it. But we need to have measures in place for the public to be safe from us, not necessarily the other way around, because a lot of us are fairly healthy people, especially if you're a letter carrier, or especially if you're working a very physical job in the fleet maintenance. Luckily, a lot of us probably have a decent built-up immune system, but that's not, unfortunately, the case for every single person at the post office, even if you appear healthy. And I think a lot of people don't recognize that we are out there every day, and we could be carriers of this, and that's a real issue in our society. And another thing that's concerning is the lack of information that's coming. Here in Winnipeg, we supposedly have one of the lowest numbers of cases of coronavirus. I believe just today it hit 21. I don't know what to believe, and I don't know what folks believe across the country. But there is a serious issue with testing, and testing is being limited to certain people. We see a lot of folks in the media, especially that of a certain socioeconomic status, that seem to be testing positive and know that they're positive long before many people that are actually ill are able to get the testing. In our workplaces, there were folks coming in sick, and there was no process enacted for people to know what is quarantine leave, because that is something that we have in our collective agreement. And I'm very thankful for those postal workers that came before me to have fought for that right. It's likely not a very easy fight that was fought, but we have quarantine leave. But unfortunately, all of those things in our collective agreement still don't protect us from the public and still don't protect us as postal workers, because they're not followed and they're not respected in all cases. And how can we respect that if we don't even have proper sanitization in our facilities, so that we can at least be working in a clean environment and not hopefully be spreading some of this illness to others in the public through the thousands and thousands of pieces of equipment and public spaces we share and touch every single day?
Thank you, Basia. Those were very informative remarks, and I was quite interested to hear the situation you face in the post office. Can we go to Janna Pratt in Regina and ask for your take on the situation? You are, I believe, you're in Winnipeg.
Hi. Hi, yeah, I'm in Regina. I currently work for Sastel in the retail store. I'm currently off right now because my daughter is immunocompromised. She was born with brain cancer, so making sure that we are protected, or she's protected, is number one right now. So everything kind of went down in March, where, you saw all of the reports, things were getting higher. We were fortunate enough that our manager for our store was forward thinking and ordered the correct sanitizing gear. One of the things that changed though last week, because we were allowing everybody to come into the store, is that we started limiting we were starting to get more to why they were coming in. So, for instance, we were allowed to ask them if they'd traveled in the past couple of weeks, and other things. And that kind of gave me a bit more confidence. But we were like, the biggest issue that we have with our customers is that they come in from one of their stops back into Canada is coming into the store. So we've had a number of snowbirds that were returning from the States, as well as people from out of country that were coming into the store and were wanting to get serviced. And that was scary. So we were really happy that we were asked these questions to our customers. Another thing that changed is that we are considered an essential service because we are telecommunications. So we're still open right now as a retail store, but we're limited to only appointments only and essential services. So if you're like SIM card swaps, if you need a new cell phone, under certain conditions, only then are we allowed to, by appointment only, for them to come into the store. So it's really helps. We've got enough clean supplies to make sure that we're clean in the store. Currently I'm off. There's a number of us that were coming in from out of country, as well as out of country and out of province, that decided to come off just to be safe. The biggest concern of mine is because I am working with the public, is the community transmission. And especially what really scared me was working with the snowbirds that came in. And we are a very small store and we're really close. So we still have to respect the social distancing rules of 2 meters apart now in the store. things are getting a little crazy here. I know that I just checked my phone, and my currently my reserve is, which I'm from the Gordon First Nation, just enacted emergency, like they just called the emergency stuff. So they're limiting people in and out, and they've extended it till June 23rd. So anybody that's coming into the reserve right now is going to be restricted and limited. And it is quite concerning how far things are really going right now. I know for certain that in like the reason that I'm off is because we've got a really good collective agreement, and it's comforting to know that I'm still getting called once my 2 weeks of isolation is up. I'll be going back to work, and I'm kind of glad that we've got all these rules set in place to restrict customers, although it is going to be concerning because I don't think that this virus is going to come to an end at all anytime soon. And even if we do get it under control, right now, like I've been reading that there is going to be second and third times that the virus is going to flare up. So even if we are careful, we have to be extra careful and change our lives, because this is going to be our new reality and how we're dealing with customers. Thanks. I'll pass it back to you.
Okay, thank you, Jenna. Can I ask you, are you, when I guess you're off now, but were you issued with gloves and masks and cleaning substance so you could clean, the desk area, and as well as social distancing? But were these measures implemented, and if so, when?
So we did not get masks, but we were issued gloves as well as cleaning supplies. I would say that would be on the 16th of March. And that was also the day that we were to be asking questions to our customers in regards to their travel.
Mm-hmm. Okay.
So,
yeah. Well, I think at this point, if we'll open it up to questions either from any of the presenters or from those who've been listening to this presentation and would like to make a contribution by joining the link.
Will, I'm sorry. We have another participant on the mic by the name of Will. So
sure. So let's hear from Will.
Will, you there?
Yeah, I'm here. Can you hear me now?
Oh, I see. There he is.
Hello. I actually didn't really prepare anything for this because I didn't know that I would be speaking, but I do have a couple of quick questions. I guess for you guys, for everybody really, what do you guys think would be the optimal response to this kind of issue, and how would socialism specifically be able to deliver that in a more efficient and direct way? That I know you've already touched on this kind of thing, that I'm really the specific way that a socialist system would be able to deliver this kind of care better. And the other thing I wanted to know, I guess, Robbie, this is maybe for you, Daniel, as well, if you guys know, are there a lot of socialists in the medical community who are open to this kind of thing? Is that something that is a prominent feature? So those are my questions.
Robbie, if it's okay with you, I would like to go first.
Sure, why don't you?
Those are great questions, Will. So I'll go backwards first, asking just about what the general thinking is on this vis-a-vis socialism. I'll answer from a scientific point of view or science community point of view. And then Robbie, if he wants to talk about doctors, that'd be great. But at least in science, I would say socialists, and I like, capital S socialists, if you will, are fairly rare. A lot of them engage in what I call scientism, where they really see the current pharmaceutical pipeline as really being the only way. I think a lot of them lack the consciousness about any other means of preparing or discovering and mass producing drugs. So they really, I think, see themselves generally as the heroes in the situation. But at the same time, they don't see the ways in which our current system undermines our own efforts. I'm not going to say that scientists don't care about making a difference. You see a lot of scientists right now working around the clock to do vital research on COVID-19. Yet at the same time, they're doing this in a competitive manner. Rather than the research group in Germany and America and Japan and China and in South Africa collaborating and sharing all the resources they have, a lot of them are just trying to be the first there. And it's not because they're even competing for profits. They're competing for jobs, they're competing for grants, they're competing for prestige. And on top of that whole academic research system, you have the companies that are competing with each other for profit. And so it's unfortunate, but a lot of them, they don't generally have this consciousness. That's something I'm working on, at least in my small sphere of influence, to increase that. If we really care about making a difference in humanity, we need to explore different ways of organizing ourselves. Because ultimately, to answer your first question, what we need is a planned economy. And that would extend into the academic world, where instead of being based on competition amongst scientific groups for being first or for being best, it's centrally organized from federal agencies that have boards that are democratically elected, that are deciding mandates openly, transparently, in a way that the resources are divided up so that we can best tackle the issues that are most important for humanity. And we don't have that right now. We have pretty poor federal funding, particularly in Canada. Compared to even other G7 nations, we're amongst the worst when you look at funding for science as a percentage of our GDP. And it's actually been going down, starting with Harper, and it's continuing to slide down with Trudeau. He has done nothing to reverse that trend. So from my perspective, Trudeau and Harper are identical when it comes to scientific issues. And we really need to change that. We can take money from what's normally reserved for national security and defense, and we put that towards science, and we do it in a democratic way for human needs first. And I'll turn it over to anybody else who wants to answer that question now.
Well, maybe I can jump in here. Those are very good points, Daniel, and I would agree with them. Doctors, speaking for the profession of which, for better or for worse, I'm a part, are not, of course, known for their progressive views, and in particular for, I guess, understanding the social factors that impact on health. Having said that, I think that the picture is better now than it was 40 or 50 years ago. And I think that this pandemic will force at least some physicians, particularly in primary care, to confront the pressures on their patients, the conflict between their work and income and their health, issues that were not necessarily front row center before for many physicians. So I'm hopeful that there will be a developing social sensitivity, and the willingness of physicians, I hope, to advocate for their patients will be, and to advocate for the healthcare system will be much more apparent in the future. I think this pandemic will change things in ways that we can't predict, but I don't know if it's going to be possible to go back to square one, both at the macroeconomic level, in terms of restoring the globalized capitalist production and consumption that in a way drove this epidemic, or if it's going to be possible for instance, for patients to go back to away from teleconferencing, which is what we're doing now with patients, going back to the old system of having to fight for an appointment and often not being able to access appointments. I think that there will be some interesting changes in the way medicine is practiced, and I actually look forward to that. So those are my comments.
I'd just like to speak on what one question and a comment by our viewers. The first one being from Julius. What do you think about the government implementing emergency laws such to forbid people from being in public spaces, breaking collective agreements of workers deemed essential, etc. And another one would, the report just given to me demonstrates the importance of education and sciences, especially virology for schools and in society. And I saw that Basia wanted to speak.
Okay, go ahead, Basia.
Yeah, so just on the question of what do we think about the government? Yeah, $1 million question for postal workers. We're famous for having our rights trampled on. Just most recently in 2018, we took strike action and we didn't even do it full on. We did rotating strikes and we got legislated back to work. So what I think of that is it's the government doing something half-assed as usual, unfortunately. And I think it's time for folks to really step it up and decide to take matters into their own hands. Do we want people to be sick? Do we want half measures? Do we want better healthcare? Do we want better public services? That's what it all comes down to, unfortunately. And I think the government is basically supporting the corporations and big oil and big pharma and the banks. And personally, I'm really tired of seeing that. Rather than bailing out the corporations, it's time to bail out the workers. A lot of people can't survive on their wages anymore, and people are overworked to the point that they can no longer sustain a comfortable quality of life. So that's what I would like to add.
Very good. Other contributions?
Yeah, hi, Robbie. Could I jump in here?
Sure.
So I actually have a follow-up question for Basia, but I'll speak just a bit. But yeah, Julius, definitely a good point about we definitely need more in by ways of virology. That's a public health need. We need teams in the field. We need people monitoring our livestock, and we need to reform the way our agricultural system works fundamentally, because right now it's very prone to this. Again, SARS was 2003. That's not a long time ago. MERS was 2012. That's not a long time ago. H1N1 was 2009. We have a lot of things very recent in our history that not only affects us economically, affects our health, it affects a lot of ways, and affects, again, and this is a point that's been brought up repeatedly, workers. It affects poor people more than anybody else. In fact, everybody else seems to profit off of that. In terms of the government response, yeah, it's been slow. There definitely needs to be, again, it's a question for socialists. Do we fight against restrictions on being able to, let's say, protest or march or anything like that? And I mean, right now, not for our own safety, for the safety of public, I mean, we care, number one, about the society we live in. It's an appropriate response, but we do need to be careful about any overreaching responses, and this has been brought up earlier by Robbie. Any attempt to slip through legislation while people are distracted, any attempt to fundamentally change rules regarding public assembly going forward, these all need to be fought against. And it's really a question for all the people in this conversation, socialists around the world. How are we going to be creative and still being direct with our action when we're largely confined to our houses? But for Basia, and as well for the last speaker, I forget your name, sorry.
Janna.
Yes, Janna. You brought up some really good points regarding just precautions for workers, especially frontline workers, essential workers, which has been dramatically redefined recently. It wouldn't be often that people would put retail workers or even postal workers in, as a frontline worker, not necessarily how people have always viewed these jobs. How do groups organize? Both of you are fortunate enough to be in unions. For people that aren't in unions, how does that happen now? Do you have any comments on how that struggle can coalesce in a way that people can win workers' rights now? You mentioned, Basia, that, again, you guys were very unprepared, and I'm seeing reports about this from everywhere, even nurses in Alberta, where collectives of nurses are refusing to test patients because they're being asked to go into homes to test people for coronavirus, yet they weren't issued an N95 mask because they're told that that's not required by the health agencies in Alberta, which is ridiculous. If nurses themselves are asking for protective equipment, they themselves are are experts in the health industry, and thankfully their union's standing up for them. But for the people that aren't in a union, how are they supposed to get this protection now? And what can we maybe do to help?
Yeah, that's a really great question, actually. And I just wanted to mention that despite that some of us are in a union, myself and Janna, it doesn't always give you the protections that you would expect. You see that our collective agreement is consistently being violated and, used as the toilet paper, which is currently out of supply apparently, by the employer. And that's really unfortunate. So sometimes, I feel that the tables have turned, especially if we look at right now. There are hundreds of thousands of workers in the grocery sector right now that are not unionized being paid hazard pay. I think that is huge. That was done with very little organizing. And I think that folks need to realize that that kind of stuff needs to continue. So even if you're not in a union, it might not be hard to organize. Folks are online now. They're confined to their home. We're more connected than ever. We just need to use the technology that we have really wisely. And I think going back to the grassroots of signs in the windows, signs on the lawns. We see what's happening in Italy. Folks are confined, but they're singing from their balconies. And that's a real way to have human connection and human understanding with people that struggle just like you, even though they might not be just like you. But we have to find a way to get through this together. And I think for workers, especially that aren't in a union, and how do we move forward after this? It's demands, just as if you were at a bargaining table. Right now, we are all at a bargaining table with our employer, with the government, with everybody around us. And workers everywhere need to demand that we're not going back to work unless we get this, that, and this. And if we don't do that and we return to our jobs and just stay with the status quo, it's going to be so much harder to try to get anything more than we currently have if we just return without any demands. And I think that's what we need to do, is we need to be organizing and we need to have a campaign. And that's where, folks in unions can really come together and really help those workers that aren't in a union. We had a few years ago when the conservatives were attacking the CBC and basically all public services. We had a campaign. I Vote CBC. We had a campaign, Save Door-to-Door Delivery. Those are very easy things that people can get behind. And those are very, very visual things that people can do for very little cost. And we tend to forget those things because we think that we need to congregate in these facilities, in these, union halls and all these places that are so archaic. But our front windows, our front lawns are essentially the meeting grounds of today. And it's so ironic because everybody has kind of resorted to their, their phones and their iPads and their laptops. And now we're seeing people going outside. So now is the time to organize in your windows and in your front lawns and share your messages and see if your neighbors and your coworkers share those values and those messages. And I think that's going to be the way that we're going to be able to do it.
That was great.
Go ahead, Janna, if you want to say something.
Yeah, hi. I wanted to, you can definitely need to push more for the government to make some changes, especially get involved because, for instance, just taking a look at what's going on with 594, which are the workers from the refinery, the co-op refinery here. They were locked out in December. They were on strike. Province in February appointed a special mediator. That mediator recommendation came out a few days ago on Sunday, and the workers agrees, but the doesn't. And at this point, the scab camp that they have outside of the refinery is starting to become an issue of public safety, especially when you are looking at the pandemic stuff that's happening right now, and they're living in close quarters out by the refinery. And, co-op doesn't want to bargain, and we're at a loss because we can't, as a union, come to support our workers because we are, in pandemic mode. Now is the time for the government to really step up and help these workers. and get them back to work, especially when times are becoming really hard for not just any worker, but for everybody. And yeah, just my thoughts in terms, of what the government needs
Thank
to
you.
do.
That was great too.
Good points. Any further comments or questions?
I have one more thing to say.
Go ahead.
All right. Right at the beginning of the outbreak, I noticed that the major thing I kept hearing in the media was about how draconian China was being. And that was like the big thing, how draconian China was being. And it really made me think about like how racist and imperialist our system of capitalism around the world really is. And there are a couple of other things that Daniel actually had mentioned during his introductory talk, where he was talking about the fact that maybe we should avoid calling this things like the Wuhan virus, China virus, or anything like that. And it occurred to me that there are several viruses that come from Africa that are referred to as Zika virus, which comes from the Zika forest in Uganda. Ebola is named after a river, and dengue as well. And it kind of just made me think about the fact that China is not one of the Western countries in the major highly significant region that has a more arm's length relationship, I should say, with the West. Whereas in Africa, it's a lot more just like pure exploitation. I don't know if there's any kind of connection here, but it seems to me like people are much more concerned with, not everybody, obviously there are crazy racist lunatics, but a lot of people are being fairly reasonable about not calling this the Wuhan virus and instead calling it COVID-19 or something more technical like that. However, we never see that. It sort of made me think about the whole imperialist structure of science, technology, how information is shared, where it's located, and all of that kind of stuff, and how this is never really considered when it comes to African diseases. I believe that if we had a socialist order around the world, this kind of racism wouldn't really exist.
I would like to jump in then and comment on that, if that's okay. Will,
Sure.
That's a very apt observation. I'm not going to justify that's entirely correct. You're right. When it comes to Africa as a continent, we see it as things that happen to them almost. It's just the way it's constructed in our common imagination with a heavy xenophobic racist framework around it. It's just this lawless jungle area, and that, of course, that's what happens there. You have all these exotic viruses. That's just par for the course, so you name it after where you found it. But we would never really, we don't quite do that with things that emerged in Western Europe. I mean, mad cow disease wasn't called the UK disease or anything like that. You tend to name things more after the vectors they come from if it comes over from our side of the pond or in our spheres of influence. So yeah, definitely it's something that going forward, I think people might be more cognizant about. The only reason I imagine, let's say even Ebola virus, which was the most recent outbreak wasn't centered on the Ebola River. That name came from 50, 60 years ago. So it's possible that didn't enter the discourse as popularly as in this case, where when people are calling it the Wuhan virus or the China flu, it's very explicit that that's pertaining to the current geographic region. But yeah, going forward and to uphold ourselves to a high standard, we should definitely call out any sort of cultural or geographic naming. There's definitely more neutral ways or technical ways of referring to any virus, and we should really demand that going forward.
Good point. Any other comments? The floor is open. Basia, no?
Janna wanted to speak. Go ahead, Janna.
Yeah.
Hi. So, like, one of the biggest hats I wear right now is just being a medical mama. being a mom of a complex child, and we have spent months in the hospital over the past couple of years. So as a parent of the patient, I've been in the hospitals to see how overworked that they are right now, and how struggle our current system is. There really needs to be a push to put more resources and doctors into it, but also being able to give them time off to recuperate. One of the biggest things of watching a lot of stuff on YouTube is that the doctors are going to have burnout levels in about a month or two, and to be able to have that rest and that time to recuperate, especially with the way they're working right now. Like, I'm worried about the next neurology appointment. Is that going to be a problem for us when we need to be there and to be able to go into the hospital and to have that same level of care? That's what is concerning for me. And to be able to walk into that and have those protections just as a parent walking in with your child into the hospital without fearing that you're going to be getting sick. And I do hope that they address those as well.
Maybe I can jump in here just to add an agreement with your point, Janna. Not just doctors, but also nurses. I think nurses are the key pivotal profession in the healthcare system, in addition to support staff, doctors as well. But there's a burnout problem also with nurses, and there's a shortage of very needed resources thanks to years and even decades of cutbacks. So we have not been prepared for this epidemic, and we lack the necessary number of intensive care beds, for instance, to really cope with an epidemic if it gets much larger, which it may well do. Already in in Montreal, one of the 3 hospitals that's been designated for COVID-19 cases that warrant hospitalization has had its intensive care beds filled up. That's the Jewish General. And there are 2 more hospitals that have, I think, only 30 or 35 beds each. So there's not much more capacity. And yet we're in the early stages of the epidemic, and nobody can say exactly what will happen, but we could well have a healthcare system that's overwhelmed in terms of the exhaustion of doctors and nurses, but also just no more beds and capacity to deal with very ill patients. I hope that doesn't happen, but I think that's the big fear here. We have a virus, after all, for which there is no immunity. There's no vaccine yet, and it will probably take another year or longer for a vaccine. And the only other possibility is to develop what's called herd immunity, which is to let the disease run its course. And amongst those people who do survive, they may develop at least transient immunity to the virus. So we're kind of stuck in a not very good place. We have to wait for this to play out, but we definitely should be demanding more resources for the healthcare system in terms of staffing and also in terms of bed capacity, because I think we're going to need it. And this was something that, successive governments have bequeathed us with their continual cutbacks in the healthcare system. And the healthcare system has fared better than many other sectors in society in that respect, but it's also fallen victim to the neoliberal mantra of austerity. Any other points?
So Janna would like to speak, but before that, we do have some questions from the chat. So I'll just ask this, and this is 2 questions from Barry. And what should our unions and the NDP do to advance the fight for basic income for all without privatizing services, for cancellation of student debt, rents, and mortgages, and for organizing gig work? In other words, fight for a workers' government rather than beg for crumbs from the boss's banquet table. So I'll pass it over to Janna. You can speak your point.
Hi. Okay. Before I answer that question, just a year ago, I wanted to mention that we were in the pediatric ICU, and that was a year ago, prior to the Children's Hospital being opened here last year. The ICU bed, and they were already doubled up. So to me, in Saskatchewan, that's really concerning. And as of the beginning of March, the Jim Patterson's Children's Hospital was already filled to capacity, and that was prior to COVID even coming out or being an issue in Saskatchewan. Now, for the question, what I think that the NDP should be pushing for is the basic income. So where you're getting a lump sum from everything to be able to cover your rent. The NDP should also be definitely pushing for like a $15 minimum wage. In Saskatchewan, low on that rate. I think we're in 25 or something like that, where it's ridiculously low in comparison to the other provinces.
Okay, very good. Other contributions?
Yeah, I'll like to jump in.
Daniel.
Yeah, so Barry brings up a good point. NDP has been obviously very much still a capitalist system and just fights for a slightly more fair, slightly more tolerable system. But when you look at the type of crisis we're facing today, and the type of crisis we'll continue to face going into the future, whether we're talking about antibiotic resistance, whether we're talking about microplastic pollution, whether we're talking about catastrophic climate change, rising sea levels, slight concessions from the mega corporations in our world aren't enough. Even if we had 10% more beds or 20% more beds, that's not enough. What we need is fundamentally a worker-run, democratically run society that can actually put all the needs of humanity first. Because as Janna just brought up, and as we all see, even before this crisis, our healthcare system was nowhere near where it needs to be to meet all of our needs. So we can no longer run on this idea in the NDP that capitalism just needs a few band-aids on it and it will be just humming along, because any crisis that comes, and again, it's a system that not only conjures up crises, but it relishes crises, and it won't do anything to prevent the crisis. It's instead going to look to profit off of it. We need a system that instead seeks to avoid, which is oftentimes much less resource intensive. And when it comes to preventing a pandemic, a team that's considerably smaller can prevent a pandemic than a team that's going to be responsible for treating all the people that contract a new virus. We can focus more on prevention, and then we can also make sure that we can put all the resources that workers have put together around the world. We have so much manufacturing. The thing is, none of these for-profit companies are willing to put in the effort, because it's not profitable, to meet immediate societal needs. Some are, but they're the exception that proves the rule. And really, the NDP can no longer run on this idea of, well, the system kind of sucks, but it's mostly the conservatives that suck or the liberals that suck, but we're good. Because what they're putting forward would not have made this situation really any more tolerable. A little bit, but not, it wouldn't have made it manageable. Because right now what we're facing is a crisis that isn't managed, and it's unmanageable considering the current tools that we have. Despite all the human endeavors, despite all the human sacrifice we're seeing, we don't have leaders, and all the resources that we built up with our own hands are not being put towards the fight. So they need to abandon this idea of reform. They really need a push for that, but they've really moved away from that.
Very well put, Daniel. Any other comments or questions?
Well, not so much a comment, but we've been at this for almost an hour and a half, so I think it's time to wrap up and have some final remarks from our panel, please.
Okay. I don't have too much more to say. I found this discussion very interesting. It's informative for me in Quebec, and I hope for everybody else. I would like to draw your attention once again to our website, www.socialistaction.ca, and invite you to access that. And I look forward to hearing and participating in further webinars in our series. And I hope the rest of you likewise. And I want to thank everybody for their contributions and those who ask questions. It's been a very stimulating discussion and gives me, and I hope everybody, lots of material to think about.
I'll just jump in really quickly to say goodbye to everybody. Thank you for, again, having me on, for the wonderful conversation, getting to meet some of the people on this panel that I haven't met before, even though it is digitally. And just say that, again, after this pandemic resolves one way or another, a lot of our institutions are going to be left scratching their heads. The leaders that went into it might not be the leaders that come out of it. So this is an opportunity to seize. And as Robbie brought up with the medical industry, this is, again, going to illuminate for a lot of people that never really saw it before, that the current system is very fragile. And really, most people suffer whenever it gets stressed. There's very few people that benefit from the system when it goes bad, and it goes bad quite often, as we've seen. So I look forward to fighting within scientific institutions, to push for more democracy, to push for more cooperation, to push for putting human needs first, for fighting against intellectual property, for fighting against patents, for fighting for nationalization of the pharmaceutical industry, and making sure that everybody can afford and access the life-saving, the life-sustaining medications and therapies that they need. So thank you, everybody, again, and I'll pass it over to the others for their final remarks.
Yeah, I just want to say thanks to everybody and thanks for having me and just speaking on behalf of postal workers. I never like to end a conversation without an ask, and the ask is to just show your support, however that might be it calling your MP, signing a petition, or doing whatever it is, of putting a poster on your window or on your lawn, showing that you support postal workers or whoever it is, the people in your life, the healthcare workers, the frontline workers, the grocery store workers. Just put up a sign because you don't know who your neighbors are and who's walking by and who's watching in your windows. And right now we could all use a little love, because sometimes it seems like we're the only ones on the planet feeling that way. So thanks to everybody and have a great night.
For final remarks, all I would really have to say is that I think what we really need is a socialist response, a socialist economy, a socialist political system, so that we can handle all of these things from the outset. The competition in the scientific world that Daniel and Robbie were speaking about is what creates, one of the factors that creates these kinds of poor response mechanisms. The capitalist economy is what helps to perpetuate and create these diseases. We have situations where people are struggling to get work and pay rent, and the government a lot of its energy on economic health and making sure that businesses and corporations are doing well, putting those interests ahead of the interests of regular folks like us. I think also on an international perspective, it's important to keep in mind that all of these things have international consequences as well, and to just view that world as well, keeping our eyes open to that as well as our immediate concerns. And I think with rational distribution of resources, a lot of this could have been avoided.
Janna, you have the last words?
Janna had to go. Unfortunately, the baby was crying.
Oh,
All right.
okay. Well, we appreciated her contribution.
Hi, sorry.
Oh dear.
Sorry, Janna, I lied.
Sorry, worries. I just kind of put her down. She's good now. But I wanted to say thank you for inviting me to this. And it was really good to listen to everybody's point of view. And like Basia said, to make sure that you're supporting your definitely the people that are working right now through it. And just be careful around them. Make sure you're being safe and wash your hands, please.
Thank you. Thank you to everybody. And hope to see you at another webinar.